Okay, so today we're going to talk about client relations. So we are going to go through some objectives that we have in this class. So demonstrating appropriate interpersonal skills with client and patient reception scenarios. That does mean we are going to do scenarios in class. Proper phone etiquette and the importance of triage. So we'll cover triage more in detail when we hit emergency in nursing. We're going to rehearse phone calls to existing and new clients at veterinary practice and discuss the professional handling of difficult clients. And then having a plan for being able to refer to the supervisor. So first, we're going to cover marketing and advertising. We're going to touch on some things that I want you guys to know about your clinics and how they keep and get new clients. First impressions, communication via, face-to-face direct communication and over the phone, and then dealing with difficult clients. So for marketing and advertising, we are going to do a couple of different things for keeping clients versus getting new clients. So for keeping clients, we want to send them appointment reminder cards like, hey, you scheduled this appointment, make sure you come, or even give them a phone call. And we have immunization update reminder. So that is, hey, Fluffy's due for some vaccines. Let's go ahead and get that scheduled and get him in. And then coupons for preventative treatment. So, hey, we want you to buy heartworm prevention for your pet. So I'm going to give you $20 off. For getting new clients, we're going to have direct and indirect marketing. So direct is public attempts to sell products, and then indirect is trying to build relationships to encourage them to come to our facility or our clinic. So some things for direct marketing, we have advertising in the yellow pages, television commercials, radio commercials in some instances, internet ads, maybe on Facebook or something like that, and then coupons. So again, we can mail, we can email. Some of the ways that some of my clinics I've seen is they'll email like, hey, your next exam, you get 10% off or $10 off, or for a new pet, you get $20 off, or new pet, you get a free exam, or I don't know, whatever it may be, depending on how busy the clinic is and how much they're wanting more business to be stimulated by sending out these emails. For indirect marketing, they can sponsor charity events. So maybe like walks, runs, whatever it may be, different community service. So, there's lots of microchip events, pre-vaccines that they all need help. And so you can sponsor them or your clinic by wearing an associated t-shirt. So that way their presence is put out into the community whenever you're doing these volunteer events. And then of course, a Facebook profile, Instagram, nowadays TikTok, all that fun stuff. Okay, so we're going to cover first impressions. So the veterinary clinic should be aesthetically pleasing. It should be clean. And the best way to do that is to have everyone contribute to that, right? Everyone is responsible for cleaning. That is important because it's not just on you guys as VAs. Everyone is responsible for cleaning in some way, shape, or form. Granted, you guys are going to be doing a lot of it, but everyone is responsible for picking up some responsibilities. The front desk area should always be set up to where the receptionist's face is clear and available. So, the computer should be at or below their face or their head, so that way the client can see over that into their face. But we never want to leave that front desk unattended. So there may be some instances where you guys are asked to help cover the front desk to check in, check out, answer the phone, answer questions, whatever it may be. The biggest thing is that clients should be greeted immediately. So sometimes, especially if you're the only person there and you're on the phone, you might want to just mute your phone for a second and just let that client know. So acknowledge the fact that they're here, look at them, make eye contact, and I'm looking up because that's where my client would be, and say, oh, I'm sorry, give me just a moment to finish this phone call. You've acknowledged that they're there, so they know that they're going to get service as soon as you're available to. And as long as you acknowledge their presence, people you'd be surprised, they're okay with waiting a couple minutes while you're on the phone. Of course, if somebody comes in and they seem very frantic or their pet's in any obvious distress, you're going to tell that client on the phone, I'm sorry, I need to put you on a brief hold, I have an emergency. And just do what you can for the patient that you have in front of you. So first impressions, general appearance is going to be very important. So always have a smile on your face. Some clinics are still having mask mandates, or beyond COVID, maybe you prefer to wear a mask. So always make sure that your eyes show that smile then. But greet everybody, even if you're just passing by. So, if you're discharging a client, you might want to just say hi on your way by, or usually what I like to do is, have you been helped? And if they're like, no, like I'm checking in or whatever, I try to do whatever I can. So sometimes it's, okay, let me grab a weight on your patient. Let me go get them checked in a computer in the back. And then I'll see where I can get you based off of, when the appointment is, or where they're at in line, or if they're just a technician appointment, then they don't need to go into an exam room. I've had people show up very early, so I stopped putting people in rooms immediately. I did that once and they were 2 hours early to their appointment because they thought it was at 12, but it was at 2. And so I actually put them in the room before the actual 12 o'clock appointment. And then of course, always wear your name tag. Always let your clients know who you are. So your name. So we have direct client communication. The ultimate goal of communication is to be understood. And so that is very important to keep in mind when we are having conversations with people, is that, okay, what is the point of me talking to this person? For them to understand me. So I want to use terms that they're going to be able to understand. I want to use language. I want to put it in a relatable sense to where they're going to pick up what I'm putting down. They're going to understand what I'm saying. So again, the ultimate goal of communication is to be understood. So we can greet clients and their pets. Again, clients will just love whenever you greet their pets, especially when you know their name. We have nonverbal communication. So it's argued that nonverbal communication is the weightier of the two. We have active listening, which I'm sure everyone's gone through at least a little bit of active listening training in high school. Answering questions, of course, is going to be very important. Owners have tons of questions. And I always like to say to them, to encourage them to ask those questions, that the only stupid questions are the ones you don't ask. Granted, maybe there are some stupid questions. I've never really encountered any question that was extremely stupid. Sometimes they just want clarification. Sometimes they just didn't quite understand using with the terms that you explained it with the first time. So I've had people ask me how many hours there are in a day, and I've had to tell them 24 because, and it's not, I don't consider that a dumb question because, we go from noon and we have 12 hours in an increment. So some people really do think there are 12 hours in a day, and they just don't necessarily have that explained to them at any point, or they don't stop and really think about it. And then collecting payments. So with greeting clients, we always greet the client first, then acknowledge the patient. Know the name before you go in, also know the pronoun, and make sure you smile. They want us to know that we like doing our job. We want to know the patient's details. So again, knowing their pronoun is going to be huge. And then you wouldn't think that trying to guess the patient's breed might lose rapport with you, but don't try to, because some people might think that their animal is one breed, even though they might obviously be something else. Sometimes we just have to roll with what they think because we don't want to offend them, or we don't want to make them feel like they are wrong about their own pet. That's definitely not the way we establish rapport or trust with our owners. So interaction between people without the use of words, so body language, is more persuasive than verbal communication. So making sure that your people know, or your clients know, that you are engaged with them, that you are fully in that conversation. So a lot of times using hand gestures, but not crazy hand gestures, just minimal gestures. Think about having a little box, and that's what you want to hand gesture within. Okay, so eye contact, facial expressions, of course, smiling, facing towards people when you talk to them, and then head tilting will show sympathy. So I usually only do that for things like euthanasias or quality of life conversations. Other times, usually I'm having, an educational conversation, or we're, like learning about the patient. They're learning about how to care for their patient. So I don't really do a lot of head tilting in those cases. But we don't want to fold our arms. You don't want to avoid eye contact. If you're not comfortable making direct eye contact, the bridge of their nose or their forehead. But people notice, they can actually tell if you're looking down from their eyes. So don't look at their nose. They can tell if you're looking at their nose or their mouth. You want to look at their forehead, okay? But not like excessively up at their head or anything like that. Again, we avoid excessive hand gestures, but we avoid no hand gestures because this would be considered very awkward. So active listening involves receiving, processing, and then responding. And that is important. So active listening, if you are actively listening to your owner, you're not just listening. Okay, you are receiving that information, those words, you're processing it, and then also being able to provide a response. So the biggest thing I like to do is summarizing what the client has told us, or by asking questions. So especially when we're getting patient histories, that might be the bulk of your client communication. Just depends on your role in the clinic. We want to make sure we're asking clarifying questions. So we'll start with an open-ended question. What brought you in today, or what have you noticed with Buddy today? And then we might have to do more prompts. So like, is he coughing anything up, or something more specific to get that information that we know we need. Okay, and then whenever we're done, or whenever we're done with the phone call, so I see we have Bella scheduled for an appointment with Dr. Smith on Wednesday, May 4th at 2 p.m. for vaccines. Does that sound okay? Or does that sound correct, or something like that? So summarizing is a nice way of making sure that everybody's on the same page. Never give information which you're not well informed. Always feel comfortable to let your doctor know, like, hey, I'm not quite sure what to tell them on this, or get somebody else, or something like that. So, if they're asking a question and you don't know the answer, don't just try to fudge it. They know. And if they don't know, then you might be giving them something incorrect or incorrect answer. We're collecting payment, so I always like to go through. So, for Luna, we've done exam, we've done rabies vaccine, we're sending home some heartworm prevention, and then a fecal cup, so that way you can bring in a fecal sample and we can send that out for analysis, and that's going to be prepaid for since you're doing that today. The total is going to be XYZ. Okay. For treatment, so like we've done vaccines, we collect payment at the end. For euthanasia, we collect payment before the animal is euthanized, because after that point, after paperwork and payment has been done, they should be able to just focus on their pet. They focus on loving their pet, and then they focus on their grief. Okay. For the business of care, although we exist to provide comfort and help to animals, it is ultimately business. So a lot of times we're not going to do any accounts receivable. So that means set up payments. So if clients are like, oh man, that's too much, can I do a payment plan? We don't necessarily do payment plans in the veterinary field, because a lot of times they go unpaid, and then that's money that the clinic is losing, and that's money that's not going into your paychecks, for example. So sometimes what clients will do is to get veterinary pet insurance to help their clients deal with the cost of care. And so the assignment that I'm giving you guys is going to help you guys kind of look into what different insurances are offered and what they can look like. A lot of them will require them to pay the bill in full and then to submit that invoice for reimbursement. So oftentimes I like to print 2 invoices. So they have one for their personal records and then one to send to the company. They'll require a monthly fee as well as a deductible. So deductible, just like in human insurance, is going to be an amount either per year or per condition or per life or whatever it may be for that insurance company, that owner has to be financially responsible before the insurance company will start paying for things. Okay. For discharging patients, so the patient has to be presentable before we actually discharge them. So make sure that they're clean, okay, that they either look better or the same since when they dropped them off. They judge the level of care received by the appearance of the patient. So by the cleanliness, by the odor. If you had a patient in for surgery and you pull the catheter out and there's blood on the arm, you better not send that patient home with blood on their arm. Or if while you're walking them out, they pee and then they step in it. Yeah, you gotta tell that owner, give me just a minute. She just peed. I just want to make sure that we're clean. So I'm just going to clean her up real quick before I send her home with you. She might be a little bit wet. I always like to warn them of that, because then they're like, oh, you left her pee. No, it's because I cleaned her. So clients will prefer staff members with the ability to project concern and caring personality. So put yourself in their shoes, but don't 100% empathize with them. Okay. So what I always like to say is give them a little piece of your heart, but not all of it, or project your heart, but don't give them the entire thing. So you need to I like to imagine that I've built a cage around my heart. So that way I haven't gotten completely in love with a patient that I'm about to euthanize, or that I'm getting too attached. So I always like for them to know that I care, because I do, but I don't like to completely involve myself in their situation, because in the long run, it's going to hurt you every time that happens, and it's going to happen a lot, and that causes burnout, and that's going to lead to you probably not working in the vet field for a long time. So I want to make sure that we're setting you up for success, and that you're in it for the long haul. So the best habits to get into is to project caring, but not to 100% empathize with them. And I know that's hard. We want to be there for them. We want to feel for them. But if you feel for them, you are going to feel for all of them. And that is too much. That is too much to take on for too long. And do not do that to yourselves. So verbal communication, we want to speak slowly with an audible tone. In some cases, some owners are very, especially like lawyers and what I found, who else? I don't know. There's like a couple groups of people that you'll end up finding out that they want you to speak quickly. So just go for what your audience is. I've literally had to sit there and talk very slowly and talk very loudly to some people that have hearing loss because of age. So you just have to go with what your client needs. But you want to take notes and document all conversations. So what I often do is I carry a little notebook with me, or at least like one of those little rings that have index cards in there. So if I have a conversation with an owner and I need to document it, I can write that down real quick, or I can write down notes or anything like that. I like to ask if they have questions. I like to say, what questions do you have? Because then they have to stop and think like, oh, what questions do I have? And then they might come up with one. And I'd rather them ask now than later, or just not ask and get confused and do something wrong. So a client's trust in our business can be built by demonstrating willingness to listen, clear and consistent communication. So that's not only between us from day to day, from call to call, but also everyone in general. So that's why it's best to set you up with best practices. So again, if you don't know something, don't try to pretend like you do. And then operating by ethical standards. So making sure that we are not operating in the gray area. We are doing what's best for our patients and what's best and correct legally. Okay, moving on to telephone communications. The first 30 seconds of contact between a client and the receptionist, or sometimes you guys, is critical to their overall satisfaction. So making sure that they're not on hold too long. So we want to answer by the third ring. That is important. We want to answer as soon as possible. The first contact most of the time takes place over the phone. So when they're calling to schedule an appointment, some people do walk in to schedule an appointment, and it's really just dependent on what their personal preferences are. Most people call. So answer by that third ring, have a smile on your face, and know what you're going to say. So thank you for calling such and such clinic. This is so-and-so. How can I help you? Or how may I help you? But know what clinic you're working at. I've worked at 2 clinics before, and I once introduced the wrong one, and that was really embarrassing, but it was a really good client. So we just laughed about it. I'm like, yeah, I work at 2 places. I'm sorry. Today's a Saturday. And they just laughed it off, and it was great, but know where you're working. Know what you're going to say. Listening on the phone involves good concentration. I personally do not advocate that you guys just close your eyes, but sometimes I literally do phase myself away from all the hubbub that's happening in the treatment area, so that way I can focus. A lot of times I'm just looking at my computer anyways, because I'm going to be documenting while I'm on the phone with them. I like to type what's going on while it's going on, or at least little notes, so that way I can go back and put in all the details. So, a client called about such and such, and then I will minimize the notes. That way I can go back and finish it later and look up all the information they need to know, or schedule that appointment or things like that. Okay, for making appointments, you need to know if they're a current or existing client, their name, their pet's name, why they're coming in. The why they're coming in is really important, because if they're coming in, or if they're trying to come in for like, my cat hasn't peed in the litter box for a couple of days, that we're actually just going to send over to emergency, because that is emergent. Whereas if they're like, my dog has been limping for a couple of months, yes, I'm going to schedule an appointment. Is next week okay? Preferred doctor before preferred date and time, because if they want to go see Dr. Goulas, then they can only come on certain days. Okay, and then I'm going to make sure that they know those days, and then they can tell me what their preferred date out of those is and their time. And then making sure we have a valid phone number. If you are talking to somebody about an emergent situation, knowing what's going on and how to reach them if the call disconnects is going to be very important. Okay. So if you do need to place someone on hold, may place you on hold for a moment while I do something for you. And usually I say a brief hold, so that way they know that I'm going to try to expedite this as much as possible. Sometimes, if your owner's talking to you and they're like, hey, can you ask a doctor for me about such and such? You'd be like, okay, I'm going to place you on hold for just a moment if that's okay. And they'll be like, yeah, that's fine. I'll wait here, or something, whatever. But may I place you on hold? So you're asking that permission and they know what's going to happen. You're not just saying, okay, I'm going to put you on hold. And then all of a sudden they hear elevator music. Check back in with them if it's been longer than a couple minutes, or if you know that it's going to be longer than a couple minutes. I like to just ask if I can call them back. If I have to go ask one specific doctor a question, I don't know if they're available. They might be on the phone, they might be in an exam, they might be in a room with a client. So I usually ask if I can call them back. Like, hey, let me go see if they're available. I don't know if they are. So do you mind if I just give you a call back? It might be a couple minutes, it might be a couple hours. Usually people, as long as you're communicating that, they're going to be okay with that. If it's longer than just a couple minutes, I always like to apologize. Usually what I like to say though is thank you for holding, and then just move on. But if it's been again longer than a couple minutes, thank you so much for holding. I'm sorry that took a little longer than I anticipated, and then continue on with your conversation. We cannot give medical advice over the phone unless it's CPR instructions or anything life-threatening. Again, when we get to triage an emergency, we'll talk about that and what you can say. If an owner feels like it's an emergency, we should treat it like it's an emergency. Now, I'll say there is a caveat to that sometimes. Sometimes owners feel like their pet's ear infection is an emergency when actually it's not. So we want to offer to make an appointment for things that aren't an emergency or that don't sound like they need to go see an emergency doctor right then and there. We want to offer to handle it for them. Or, if it is an emergency, we want to offer to give them directions to the closest emergency clinic. So know your hospital's policy. Some clinics, if they're general practice, they don't see any emergencies. Some clinics might see urgent cares. Some clinics are emergency, and then they're like, yeah, come down right now. Why are you calling me? Just get down here. When are you going to be here? Cool. So just know what your clinic's policy is on that. The most important thing for an emergency is to stay calm. So grab a doctor or a tech if you don't know exactly what to say, but you need to stay calm because they are not. So you need to be their rationale in that case. Okay, moving on to dealing with difficult clients. So behaviors that will help avoid confrontation or help prevent issues from arising whenever you're dealing with clients is to be courteous, be assertive but respectful, and then control your own emotions. So don't take things personally. Don't let your anger tell you what to say. That's going to be really, really important. Is you need to remember that you are here for that pet, and that owner is simply helping you care for their pet. Okay. So if a client is shouting at you and upset with you in the lobby or in somewhere that's public, you need to take them out of that area. So either into a different area of the lobby or like a side lobby, or you need to put them in an exam room. Okay. I would rather take up an exam room for a difficult client than a tech appointment. Okay. We want to try to identify the cause ASAP. So, I'm sorry, sir, what's going on? Well, you did something wrong. Okay. Well, sir, I would love to try to help this situation if I could just understand what exactly went wrong so I know how to fix it for you. Okay. Killing them with kindness, you'd be surprised, works a lot of the time. Not all the time, but a lot of the time. And if you just tell them, yeah, I'm on your side. I am upset, but I want to fix it. Okay. I do not recommend getting on their level, but like of upset. But if you just tell them, yeah, that I can definitely understand your frustration, or that doesn't sound like a good situation. What can I do to fix it? Okay. So initially agreeing with them lets them know that you're listening and that you actually do care. So again, killing them with kindness is going to be really important, because if you're telling them, man, that does really sound frustrating. How can I help? Or how can I fix that for you? They're going to be like, oh, okay, well, this is what I need. Or sometimes they're going to continue yelling at you. But you want to develop a relationship. So you want to, okay, my name is Madison, or my name is Maddie. Sometimes I refer to myself as Madison because it's easier to say over the phone or hear over the phone. Anyways, but you want to let them know who you are and what you are doing for them. That is really important because they want to know that progress is being made. So, if they feel like they were overcharged, like, okay, my name is Maddie, by the way, let me look into this. Let me print out an invoice so we can go through it and you can tell me what's wrong on it. Okay. And so that way they can literally go there, sit with you, mark what's wrong, and then you can go and investigate. Okay. So if a solution is not found immediately, ask their outcome. It's not always guaranteed. So For example, we cannot accept prescription refunds, like prescription medications, to give a refund if they've left the building. Okay, once they've left the building, that is it. We cannot refund them. We're legally not allowed to. So if they're like, I want a refund, my pet passed away. I'm sorry, sir, I can't do that. But if you'd like to donate the medication, we can definitely do that. If you can't find an exact solution immediately, sometimes you might just need to escalate it to your manager. So if it's a policy issue or something that you absolutely cannot budge on yourself, then you might not, you might not want to have that conversation continue with the client. You might want to just go ahead and escalate it. But you never want to interrupt a client when they're speaking. You never want to raise your voice, and you never want to place blame or anything. So even like equipment or computers or other clients, other employees, I'll tell you, I've had some pretty bad managers. I had a manager blame me for overcharging a client when it was their policy. And so I had to take the blame. The manager said it was my fault, and then it was my fault. Of course, I no longer work there anymore. But you don't want to take anything personally, especially from your clients when they're in the heat of the moment, when they're upset. They might say some things that they actually don't mean. And you'd be surprised. I've had people yell at me and then actually physically come back into the clinic to apologize. If you are showing that you care and showing that you want to help them, they oftentimes de-escalate. You'd be surprised. But, if you are sitting there trying to figure something out, you don't want to say like, oh, I'm sorry, my computer's not working or what have you. I will tell you sometimes like, oh, my computer's running a little bit slower than I want it to. Give me just a moment while this loads. Or if you, I don't know, just try not to place blame. Usually what I do is I just explain what I'm doing. Like, okay, I'm just pulling up the invoice. It takes a few clicks to get there. Give me just a moment. Something like that. I usually sometimes try to make like a slight joke in there. To try to ease the tension a little bit. Always apologize for any misunderstanding or miscommunication, but of course, the common ground is the health of their pet. So, you can be like, oh, I want to help. I'm trying to come up with another animal name. I want to help Cheeto as much as possible. That's my cat. Let's see what I can do. Validate their feelings. Make sure that they know that the matter will be resolved. And then if they are absolutely yelling at you, have somebody else there with you, have a witness. And so that way, when you go document the conversation, it's not then just a he said, she said. It's yes, this is the conversation I had. And then this person can say, this is what I witnessed. And it's just going to help with that CYA, cover your butt. But it's also, if your doctor gets taken to the board, then you have 2 witness accounts of that situation. Okay. So you guys will have an assignment about insurance and payment plan. I provided that on paper. So if you guys have any questions, please let me know. But the client education requirement part is going to be fulfilled in the husbandry class, which I just gave you that project. So of course, please let me know if you have any questions, and we'll be doing some scenarios in class next week. Look forward to seeing you then.